Just while they're doing that, tēnei te mihi ki a koutou, he mihi mai oha, he mihi aroha hoki, tēnā koutou katoa. Whaafetaile alofa le atua o tātou whailua i le langi I mamā, ai le o tā ape o papa. A veelo o leo vai vai e whaafeilua I atu. Okay, we've got it sorted. It's great to be here this morning and certainly an honour to be able to speak to you this morning. Hands up those of you who identify as Pasifika. Put your hand up. Raise your hands. Raise them up. Got a couple of hands there. Okay, these are the experts in Pacific Health and these are the ones that you go to for answers if you have any questions. I do want to acknowledge all of you here today and the work of the NGO Council as well as all of the NGO providers. I'm very aware that in my role as the Chief Advisor Pacific, a lot of the work that I do is working alongside our Pacific health providers. I know the stories that they tell of working above and beyond the call of duty, and so it's no surprise to me that when you gather together, there's probably stories that can be told over and over again of the work that you've done, the work that you do, which is probably under-resourced, and yet you continue to go to work every day to do this work in order to make the change happen for our people in Aotearoa. I wanted to start possibly by telling a migration story, because my father, who just recently passed away at 93 years old, came to New Zealand in 1953. Now this story is very common of many of our Pasifika families, where the first one came and then was charged to bring the rest of our families over. When he came in 1953, he then went back. He came and got a job, went back to Samoa, brought my mother over, and then started our family. Within about 5 years, he had purchased a home in Mount Eden, for those of you who are from Auckland, and then raised our family. Little was he to know that about 5 years later, his wife would be diagnosed with cancer, and then a few years on from there would eventually die of cancer. So he's a man of amazing talents and strength, and it's through that many of us who have followed behind after him have, I think, gained the strength to do the work that we do. One of the key things that I've learnt in this role too within Pacific Health is that there are many who continue to work endlessly and tirelessly in the roles that we have in working with our Pasifika families and communities. I had the experience just recently when I ordered a taxi to go to the airport, and in the space of just a few minutes, the taxi driver, who was a Cook Islander, he introduced himself and he said he was Cook Island Māori. His mother was Rarotongan and his father was Māori. We got to the top of the street and I could hear some of the comments he was making about drivers on the road, and I was starting to get a little bit scared. As we continued, he said to me, "You know, I used to have a problem with anger." And I thought, really? But you know, he continued to say, "I had a real problem with anger." And it wasn't, I said, "So what did you do?" And he said, "Well, I went to the doctor." And back in the day, probably about 10 years ago, a lot of the guys, they don't go to doctors to talk about their anger problems. And I said, "So what happened?" He said, "Well, the doctor said to me, what was supposed to be a 5-minute, time with the doctor ended up being half an hour. And he said, he referred me to a psychologist and I had a few sessions. You know, I feel like that made the biggest difference in my life." And he continued to go on about how working with this particular psychologist had certainly opened the doors to him talking about what was happening. But I really commended him and I said, "You know what, you're doing a really good job. The fact that you are still working hard and making a difference in your community is going to make much more of a difference when you talk to other men." And he said he'd had the opportunity to also talk to men of his age to going and getting the help that they needed. Interestingly enough, as I jumped out of the car, he said to me, "You know what? You speak really good English." And I just laughed and I thought, "Thank you, sir. Enjoy your day." Interestingly enough, I arrived in Wellington and I don't normally order a taxi, but for this time I knew that I probably wouldn't get a taxi, so I ordered a taxi. And I was greeted by a Samoan man who was holding a sign up with my name. And he said, "Oh, do you know so-and-so and so? They've got the same surname as you." And again, one of the key things with Pacific people is it's not so much what you know, it's who you're related to. And so I then proceeded to say, no, that's probably the 50th time somebody's asked me if I'm related to that person. I think they're related to my husband, but I'm not related to them. And then he proceeded to tell me his life story as we were sitting in the taxi. You know, I've talked to people and some of them say to me, when I hop in the taxi, I don't say anything to the taxi driver and I don't expect them to say anything back to me. But for some reason, I hop into the taxi and they start to pour out their life history to me. And I'm amazed at some of the stories that they tell. But in this particular instance, this older Samoan man who was in his 70s, he described to me his life story in the short time that we were driving to the Ministry of Health. He talked about the fact that he'd worked with a radio station and been an announcer. He talked about the fact that he had helped his family to find a home and every other family member that had come through from Samoa to New Zealand. All of these men, these two particular men, showed examples of great courage in the work that they're doing. They just wanted to be heard, and their story was about the difference that they were making for their families. I wanted to share the migration stories because it's very important, again, that we recognise where these people come from and the difference that they, as well as those of you who are sitting in this room who have migration stories, are able to continue to do the work that you do in your everyday life. So just to tell you also about, because one of the key things that I found in the 35 years that I've worked in health is that people know about Pacific, they know about Pacific Health, but they actually don't know about Pacific Health. Many of them make assumptions around Pacific. So what we know is that we have a diverse, youthful and largely urban population. Many of our Pacific peoples are also New Zealand born. At least 90, I think it's a greater proportion of our Pacific people in New Zealand are now born in New Zealand. They're multi-ethnic, they're transnational in their cultural identities, which means that they don't necessarily identify with one specific Pacific identity. Many of them may also identify with those with their homelands, or they may identify with the contemporary New Zealand values. What we know is a lot of these our Pacific people are creative, they're connected and dynamic, and they have vibrant and positive contributions to New Zealand, as you'll hear the stories of those that you work alongside. But what we also know is that many of them also experience long-standing inequalities. And so some of the challenges that we have are around how we can make that difference to improve the outcomes for Pacific peoples. And it was good to hear again with the wellbeing budget and also with our Minister of Health this morning talking about achieving equity of outcome for Pacific people as well. Just looking at the Health and Independence and Health report, some of the key things that we've seen from this show very clearly that there have been differences made for Pacific Health. What we know is that it highlights the fact that there are high enrolments of Pacific people with PHOs. We have high rates of infant immunisation, and our Pacific young women have the highest HPV IMS rates. Our screening rates for breast and cervical cancer have increased among Pacific women, and we're seeing a decreasing amenable mortality rate. However, on the other hand, as you can see on the other side, there's higher exposure to health risk factors such as high BMI, smoking and physical activity. I don't think that any of this is new to anyone, but sometimes it's good to be reminded that there are distinct differences between Pacific people and those who are non-Pacific. I think one of the key areas as well is around our high rates of avoidable hospitalisations for our children, which is quite significant. In the recent mental health reports, we see that Pacific peoples report high levels of well-being, family well-being, and they're all well connected socially and culturally. However, what we also note too is many of them also experience psychological distress at higher levels than non-Pacific adults. There are differences in mental health outcomes, and I think one of the key things that we need to also recognise is the need to recognise the differences in ethnic specific groups, that we're not one homogenous group, but there are significant differences between Samoans, Tongans, Niueans, and also between those who are born in the Pacific and those who are also born here in New Zealand. So that raises some issues around a one-size approach does not fit all, and that we need to talk to our communities around how they want us to work with them. A really clear example, and you would have heard the Minister also talk about rheumatic fever, the funding that was made available in the budget, is that rheumatic fever is an example of a condition where there are huge inequities. What we know is that it affects primarily Māori and Pacific, and the latest data actually shows that the rates of rheumatic fever in Pacific people are increasing, particularly in the Auckland area. One of the key things that we've done in the last few years has been working with providers to work alongside our communities. But you know, at the end of the day, as much as we can raise awareness, as you all know and are very keenly aware of, is that much of the change that needs to happen is around housing and economic levels for our families. When we pulled together a group to talk about some of the things that we needed to do to change the outcomes around rheumatic fever, the response that we got probably fits with many other things that we need to do going forward, not just in relation to rheumatic fever. The things they talked about were that poverty and housing needed to be addressed, system changes needed to happen, partnership and collaborative approaches were important, and that also ethnic-specific responses were invaluable to making the change happen. And that also initiatives and solutions need to be community-led and family-driven. Again, this is not anything new that we may have heard, but sometimes it's all very well to know, but then to practice what this means and then work with our families and communities is often another story. Again, having worked with Pacific providers across New Zealand, I've seen many of them put this into practice, and the changes and the outcomes that they've seen have been quite significant. This one is really about diabetes. I'm not going to go into any detail. I think you're very aware of the change of the impact that it has, particularly for our Pasifika communities. You'll see from the graphs in the top around the inequities that we see, prevalence of for Pacific, Māori and Asian people. And in the bottom graph, we also see the inequities around mortality rates for Pacific and Māori. So just going back to the overarching Health and Independence report, what it was telling us that we are living longer and spending more time in good health. At the same time, we're spending at least a decade in poor health, and this is slowly increasing. Long-term conditions are a major and growing contributor to poor health and premature death, and around a third of health loss can potentially be avoided by tackling key modifiable risk factors. And this is the area that many of you are working in, so it's no surprise to you. So what is it that we need to remember? That we're making progress, but significant health inequities remain across a range of measures, particularly for Māori and Pasifika peoples. The story that we tell is that many of you and the work that you do are making some really good changes for our families, but there is more work that needs to be done. Again, the challenge for us is how do we support the work that you do? How do we ensure that the resources that you need are put into place so that we can see these changes happen? I want to just finish off by I jumped into another taxi. So this is another taxi driver story. I was coming down here to this. For some reason, I jumped into a taxi and they just want to pour out their life story. And I had a thought to myself, I wonder if we set up sort of GP clinics or nurse-led clinics by being a taxi driver. Maybe that would be our way of getting around reaching men so that they can talk about the issues that affect them. But I came down in the taxi and this particular driver was Fijian Indian, and he picked me up from the ministry, so he knew I worked in health. And he immediately said, you know what, I've just come from the hospital, I've been there for the last 4 hours. And I said, what happened? He said, well, my daughter, she's got asthma, and I took her to Keneperu, and then they said I should take her to Wellington Hospital. And then he said, you know, it was really hard because I'm trying to tell my daughter she needs to do this and this and this, but she doesn't listen to me. And yet when I went to the hospital, they told me this and this and this. And he said, I'm really a bit confused. So we talked through what it is, and I was advising him how he should work with his daughter and using a preventer, and then to making sure that she put things into action that would prevent her from getting an asthma attack going forward. I guess my point in telling these stories about these taxi drivers is that many of them are telling their stories about the impact of life on them and how it is that they're managing to work with their families to create change that's going to see life differences for them. At the end of the day, we can make a huge difference by supporting people to live well, but we often need to start very early, and it's really about listening to people. We want to be in a position as a ministry to also listen to you, and I guess the fact of coming together here is really about listening to the stories that you're telling so that we can work together to work for the well-being of our families and communities. For Pacific people, they want the same as you. They want a life that's going to create change, that's going to see their children succeed in school. They want an opportunity to live in a home that's warm and dry. They want the best. They want to be able to get jobs so that they can put food on the table. And I want to congratulate those of you who've been working with our communities to make that happen. But there are more who continue to not succeed, and it's those people and those families that we need to work more with. I don't have anything more to add other than to say the importance of achieving equitable outcomes for Pacific is going to make the biggest difference for this nation. And if we don't, then we're going to see and reap the consequences of it. But again, well done to all of you for the work that you've done so far. Whawhitei lava, ma i manuel tatou aso. Tai.